The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.
And I'm living local. I'm living local 'cause it's where I love to be.
Welcome back to Loving Living Local. I'm Gretchen Wirtz, and today we are getting healthy with UnityPoint Health, and more specifically with my new friend here, Sue Tisdale, a community educator with Unity Place. Thank you so much for joining us today.
Thank you for having me.
Yeah, we've been talking already, and it's fascinating kind of to talk about this, but you go around kind of educating people about the opioid epidemic and passing out naloxone. Tell us a little bit about how your position started and what your work you've been doing.
So my position started essentially after experiencing real-time experience with my son struggling with substance use disorder for about 12 years of his life, and ultimately took his life February 8th, 2015. And I kind of got connected with this position simply because I had some experience in training, education, and distributing naloxone to try to help save lives and hopefully not have another family experience what my family has.
So this grant this is a federal state grant that kind of created this position for you, right?
Yes, so the grant was awarded from SAMHSA down to the state Illinois Department of Public Health, and Unity Place was awarded the grant in 2017, which covers actually 40 counties in Illinois, and I cover 15 of those counties.
Okay, so that's a lot. You're out there and you are educating people, you're passing out the naloxone, a little bit of both of that. What's the biggest thing you want to get out to people to educate them about preventative?
I think my biggest message at this time is a lot of people still think, well, this isn't going to happen to anyone that I know or that I care about, and simply know that this could happen to anyone, whether you're prescribed an opioid or you're obtaining them illicitly. Right now we have a threat of fentanyl content in just about everything purchased or obtained illicitly. So being educated, I know from my personal experience, is key to better understanding that substance use disorder, and specifically opioid use disorder, is much more than just a choice that person makes every single day. And understanding that is actually the steps and key to being able to help save people's lives and hopefully support them and reinforce the fact that these are human beings and that we need to try to help to save people's lives.
The naloxone, so tell us what that is exactly.
Naloxone is a medication that has been around since the 1960s, and it is an opiate resistor, meaning that it will actually block the opioid receptors from the opioids resting and having an opioid overdose, but it will reverse the effects of an opioid overdose, literally within minutes of it being administered, unless additional doses, multiple doses are needed. But the medication is what I've actually been told from a lot of various individuals, first responders, that it is a miracle drug.
Yeah, and anybody can have this and obtain this and have this on site, and they're ready for something like this. If they just get in touch with you, you'll go out and educate them and supply this naloxone.
Yes, I mean, this grant is amazing in providing the free education and also the free training and equipping anybody in the state of Illinois basically with naloxone, teaching them, the signs of an overdose, what causes an overdose, and of course responding with naloxone.
And then hopefully putting them on the right path and giving them the resources to start that healing process.
Yes, the kits that I distribute include a lot of different resources, as well as instruction on kind of a brief summary of walking step-by-steps through on how to respond, and of course the nasal naloxone.
Okay, Sue, thank you so much for joining us, and thanks for sharing your story, and thank you for doing what you're doing. If you would like to find out more, you can go to unitypoint.org, look for Unity Place, great resources there, and you can talk to Sue yourself. Sue, thank you so much for joining us.
Thank you.
Yep, we've got more coming up. Keep it right here.
I'm living local 'cause it's where I love to be.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.